Welcome to the deep dive. We're here to plunge into some really complex topics and hopefully bring you some fascinating, maybe even surprising insights. Today, we're stepping into, well, kind of hidden world, bovine abomasal diseases. These conditions can be so tricky, they often seem like a real veterinary mystery. We're going to be unpacking excerpts from bovine abomasal diseases, displacement, volvulus, and ulcers. And our mission really is to give you a shortcut to understanding these conditions. They have a huge impact on animal health, productivity, and, farm economics. We want to reveal some surprising facts and practical knowledge about these struggles that aren't always obvious. So get ready because this deep dive is for you, helping you see beyond just the surface of animal health. All right, let's begin this journey. The star of our show today is the abomasum. What exactly is this true stomach and why does it sometimes, well, wander off?
Right. So the abomasum, it's essentially the true stomach in ruminants like cows, sheep, goats. Unlike their other stomach compartments, which are more about fermentation, the abomasum is where most of the chemical digestion really kicks off. It's much more like our stomach. An abomasal displacement, it's exactly what it sounds like. This crucial organ shifts out of its normal spot, and it's surprisingly common, especially in high-producing dairy cows, often within about a month after they give birth.
A month. That's a very specific and pretty critical window, isn't it? So what causes this internal migration? Is it just one thing or more like a perfect storm?
Well, it's definitely a perfect storm. Multifactorial is the term we use.
Hmm.
At its core, you often see abomasal hypomotility, basically. The stomach just isn't moving enough, or maybe there's a problem with its own nervous system. Lots of things can contribute. For instance, metabolic imbalances, things like low calcium, hypocalcemia, or low potassium, hypokalemia. These directly affect muscle function, including the stomach's contractions. Then you have concurrent diseases, mastitis, metritis. They're often linked to something called endotoxemia.
Endotoxemia. That sounds serious.
It is. It's when toxins from bacteria spread through the bloodstream, causes inflammation all over, and that definitely affects stomach motility. Other things too, like decreased rumen fill a slough in the rumen, leaves more space for the abomasum to move. And of course, the huge hormonal and anatomical changes around calving time. That's a massive factor.
Yeah.
And yeah, even genetics can play a part, making some cows just more susceptible. When it shifts, it usually goes one of two ways. The most common one, maybe 80–90% of cases, is a left-displaced abomasum, LDA. That's where the gas-filled abomasum gets kind of trapped between the rumen, the big fermentation vat, and the left body wall.
Okay, LDA is the common one. What's the other?
The other is a right-displaced abomasum, or RDA. Less common, but definitely more serious. RDA is associated with significantly higher complication rates and unfortunately lower survival rates compared to LDA.
So if a cow has one of these displacements, what are the subtle signs, the things a farmer might miss but are actually, big red flags? Sounds like they're not always obvious.
That's exactly the challenge. You might see a lack of appetite, especially for grain, though they might still nibble on hay or silage. And you'll definitely notice a drop in milk production. That's pretty consistent. But here's the really interesting part, the surprising insight. In simple, uncomplicated displacements, the cow's vital signs, temperature, heart rate, breathing, are often completely normal.
Wow, completely normal. That would make it hard to spot early on.
Exactly. You're not seeing the typical sick cow signs you'd expect when a major organ is out of place. You might, however, pick up on signs of ketosis, that's a metabolic issue, and maybe some dehydration.
Given how subtle those signs can be, I'm really curious, how does a vet get the definite answer? What are the sort of diagnostic secrets?
Well, the absolute classic, the hallmark finding, is a characteristic ping.
A ping, like sonar.
Sort of. You listen with a stethoscope while tapping the abdomen in the right area. If the gas-filled abomasum is there, it sounds like tapping a taut, hollow drum. Ping. You usually hear it over a specific zone, kind of from the hip bone down towards the elbow, either on the left for LDA or right for RDA. There are other methods too, of course. A rectal exam might reveal a very gassy or strangely empty rumen. Ultrasound is very helpful nowadays. And there's something called the lip tack test, analyzing the pH of fluid drawn right from the abomasum. And, you have to rule out other causes of pings, like free gas in the abdomen, pneumoperitoneum. But those pings usually sound different, less resonant, maybe not always in the same spot.
Right, so diagnosing takes some skill. Once it's confirmed, what's the plan? Are there non-surgical fixes or is it usually surgery time?
It's a mix, really. Two main paths, medical or surgical. For LDA, sometimes medical treatment works. That might involve drugs to reduce muscle spasms, spasmolytics, and pain relief, analgesics. And there's a classic non-surgical technique, rolling the cow.
Rolling the cow. Seriously.
Yep. You carefully cast her onto her right side, then roll her through about 180 degrees. Sometimes that movement can actually pop the abomasum back where it belongs.
Mm-hmm.
Even just the movement during transport in a trailer can sometimes correct it spontaneously. Kind of amazing. But, and this is the major downside of these non-surgical approaches is the high chance it'll happen again. Recurrence is common.
Ah, okay. So that's where surgery comes in as maybe the better long-term bet.
Exactly. Surgery is actually the only treatment for Abomasal volvulus, which we'll get to, and it's definitely preferred for RDAs because of that high risk they might twist into a volvulus. For correcting an LDA surgically, vets have several options. Some are open surgeries, making an incision to physically reposition and secure the abomasum, basically stitching it in place so it can't move again. Techniques like omentopexy or abomasopexy, depending on what they attach it to. There are also minimally invasive, closed, or laparoscopic techniques now, though you have to be a bit cautious with some blind suture techniques done percutaneously, as they can have higher risks and maybe lower success rates. For RDA and that more serious volvulus, the typical fix is surgery from the right flank, a right paralumbar fossa omentopexy.
Seems like timing would be critical with surgery.
Absolutely crucial. The time between when the problem starts and when surgery happens is vital for success. And it's not just the surgery itself. Ancillary treatments are really important. You have to treat any other issues going on, metritis, mastitis, ketosis, whatever else is contributing. Giving calcium, either injected or oral, helps get the abomasum moving properly again. And interestingly, giving the antibiotic erythromycin around surgery time seems to help increase abomasal emptying and can even boost milk production afterwards.
That is interesting about the antibiotic. What about fluids? You mentioned dehydration earlier. How key is that?
Incredibly key. For simple displacements, sometimes just access to water in a salt block is enough if it hasn't been going on too long. But for cases that have been around longer, giving electrolyte solutions through a stomach tube, a nasogastric tube, is really helpful. And if there's significant dehydration and metabolic upset, then IV fluids, intravenous therapy, are essential. Often something like hypertonic saline to quickly rehydrate and correct imbalances. And here's a really fascinating side note. Sometimes abomasal displacement or volvulus can actually be associated with atrial fibrillation and irregular heartbeat.
In the heart, because of the stomach issue.
Yeah, it's thought to be linked to those concurrent low potassium levels, the hypokalemia, and also metabolic alkalosis,
Yeah.
and acid-base imbalance. But the good news is, fixing the stomach problem, correcting the displacement or volvulus, almost always resolves the heart issue within about 5 days.
Wow. Okay, so displacement is one thing, but you mentioned RDA carries a risk of something worse volvulus. Let's pivot to that. It sounds like a true emergency.
It absolutely is. Abomasal volvulus, or AV, is a really severe form of right-sided displacement. What happens is the abomasum actually twists on its mesenteric axis. Think of it twisting at its root where the blood supply attaches. This cuts off blood flow, causing abomasal wall ischemia. The tissue starts to die and creates a complete blockage. It's a massive medical emergency because that strangulation can be fatal very quickly.
How fast do things deteriorate? And what signs really scream volvulus emergency to a vet?
Things go downhill rapidly, dramatically. Unlike a simple displacement, the cow shows complete anorexia, zero appetite. Milk production plummets, often straight to zero. You'll see clear signs of shock because the blood circulation is compromised. Dehydration is much more severe, particularly in cows that don't survive. The heart rate is usually very high, consistently high, which is a bad sign. They might be breathing fast, cachipnea, and you might even see distended bowels.
Yikes. Given how critical it is, how do vets confirm it's definitely volvulus, especially when time is so short?
Well, that's the tough part. Clinically telling the difference between a simple RDA and a full AV can be incredibly difficult, even using ultrasound. Often, the definitive diagnosis of volvulus only happens during exploratory surgery, which just highlights why you need to act fast if you even suspect it.
So immediate surgery is the only way forward then. And if it is confirmed, what's the outlook?
Yes, immediate surgical correction is the only hope. It's usually that same right flank approach, the right paralumbar fossa omentopexy. What's really important, though, is what happens before surgery, too. Vets will often give antioxidative drugs, things like vitamin C, vitamin E, maybe dexamethasone. The idea is to limit reperfusion injury. That's damage that can happen when blood flow suddenly returns to tissue that's been starved of oxygen. It also helps prevent the stomach from just stopping working after surgery, what we call postoperative abomasal atony. And of course, aggressive IV fluids and electrolyte therapy are absolutely vital to stabilize the cow.
And the prognosis.
Honestly, it's generally guarded to poor, especially if the strangulation has been severe or prolonged. Tragically, if a cow is already down and unable to stand when presented for surgery, the outcome is almost always fatal. Other poor prognostic signs include more severe dehydration, a very high heart rate, certain blood work abnormalities like low sodium, high L-lactate, high phosphorus before surgery, and then during surgery, if the vet finds the abomasum is massively dilated and twisted, or if other parts of the stomach complex are involved, that also points to a very poor outcome.
Okay, a really serious condition. Let's shift gears one last time to abomasal ulcers. These sound like they could be anything from a minor nuisance to, well, potentially fatal, often with confusing signs. Another internal struggle.
You got it. They really run the whole spectrum. Abomasal ulcers are basically erosions or deeper sores in the lining of the abomasum, and they're actually pretty common, maybe more common than people realize in both dairy and beef cattle.
So what's causing these hidden lesions, and why do they show up so differently?
Again, it's usually multifactorial, lots of things feeding into it. We see them most often in high-producing dairy cows, again, those first 6 weeks after calving. The stress of being freshly calved seems to be a big trigger. They're also linked with other metabolic problems like ketosis, and yes, even with abomasal displacement itself, diet is a huge factor. High-concentrate diets, lots of starch, can lead to ruminal acidosis, which impacts the abomasum. Even just coarse, rough feed can physically irritate the lining.
Are infections involved? Like stomach ulcers in humans?
Well, certain bacteria like Helicobacter pylori have been found, and Clostridium perfringens, Candidatus helicobacter bovis. But their direct causal role in cattle ulcers isn't totally proven like it is in people. It's still being researched. What we do know can cause them is certain medications. NSAIDs, nonsteroidal anti-inflammatories like meloxicam. They can definitely induce ulcers. They can irritate the lining directly. They reduce protective substances called prostaglandins, and they can decrease blood flow to the stomach wall. Other potential causes, certain cancers like lymphosarcoma, copper deficiency, physical trauma from things like hairballs, trichobezoars, or ingested sand, and just general stress raising corticosteroid levels can cause the abomasum to secrete too much acid and pepsin.
So many potential causes. And how are they classified? You mentioned different types.
Yeah, they're usually classified by depth, which tells you how severe they are. Type 1 are just superficial erosions, not going all the way through the wall. Type 2 are deeper, non-perforating, but they cause significant internal bleeding. Type 3 have actually perforated, gone right through the wall. But the resulting infection, the peritonitis, is localized, contained in one area. Type 4 are also perforated, but the peritonitis is diffuse, meaning it's spread widely throughout the abdomen, much more serious. And there's a type 5, which is a specific type of perforated ulcer where the peritonitis is confined within the undul bursa, a kind of sac within the abdomen. Okay, quite a range. So what would someone actually see? From really subtle signs to, well, the worst case scenario. The signs are incredibly variable. That's what makes diagnosis tricky sometimes. Generally, you might see things like poor appetite, maybe some teeth grinding, that's bruxism, mild signs of colic or abdominal pain, maybe a slightly fast heart rate, like 90 to 100 beats per minute. You might find occult blood in the feces blood you can't see but shows up on a test. Reduced rumen activity, lower milk yield, maybe diarrhea. If the diarrhea looks black and tarry, that's called melena, and it's digested blood, a big clue for bleeding ulcers.
Okay, those are general signs. What about by type?
Right. Type 1, the non-perforating ones, are often subclinical. The cow might seem perfectly fine or maybe just slightly off her feed, a little less gut motility. Very subtle. Type 2, the bleeding ulcers, those are much more dramatic. You see signs of significant blood loss, anemia, pale gums, that black melena in the stool. The heart rate will be much faster, maybe 100 to 140. Fast breathing, weak pulse, cool extremities, signs of shock. But remember, melena might not show up immediately in really acute bleeds. It takes about 8 hours or so for the digested blood to appear.
And the perforating ones, type 3 and 4?
Type 3, with localized peritonitis, might look similar to traumatic reticuloperitonitis or hardware disease, sort of nonspecific abdominal pain signs. Type 4, though, with diffuse peritonitis, those cows go downhill fast. Septic shock usually develops within 24 hours, complete anorexia, very high heart rate, teeth grinding, belly distension. They often end up lying down, unable to rise, pale gums, cold extremities. And interestingly, their body temperature might actually drop below normal as they get close to collapse.
And you mentioned a specific issue in calves.
Yes, abomasitis in very young calves, usually under 3 weeks old. It's grim. They get depressed, bloated abdomen, maybe show signs of colic. The abomasum is inflamed, full of gas, often foul-smelling clotted milk. And they frequently have severe hemorrhage or perforating ulcers. It's Highly fatal, unfortunately.
Goodness. So, with all these varied signs mimicking other things, diagnosis sounds like a real challenge again. Once an ulcer is suspected, what's the treatment approach?
It is challenging, mainly because the signs can be so vague. However, if you see that classic melena, the black terry stool, that's a huge pointer, and sometimes you can make a diagnosis just based on that in the physical exam. The fecal occult blood test is probably the most useful diagnostic aid to confirm bleeding somewhere in the GI tract. If you suspect peritonitis from a perforation, sampling abdominal fluid, abdominocentesis can confirm it. Ultrasound can sometimes visualize a type 3 ulcer with localized peritonitis. Blood tests are important too. A low packed cell volume, or PCV, confirms significant blood loss. And interestingly, in older cattle, say over 5 years old, that are anemic, it's worth testing for bovine leukemia virus, BLV, because lymphosarcoma, a type of cancer, can cause abomasal ulcers. And of course, you have to rule out all the other things. It could be hardware disease, simple indigestion, twisted intestines, abomasal volvulus.
Okay, so once you've narrowed it down, what's the treatment game plan?
The main goals are 1. Address the ulcer itself, 2. Manage any complications like bleeding or peritonitis, and 3. Crucially, try to correct whatever underlying factors might have caused it in the first place. Diet is absolutely key. Just getting the animal to eat is so important. Food acts as a natural buffer for stomach acid and helps raise the abomasal pH. Then, you want to decrease acid secretion. Vets might use oral antacids. More effectively, they use drugs like H2 receptor antagonists, ranitidine, cimetidine, or the even more potent proton pump inhibitors, PPIs like omeprazole or pantoprazole. These have been shown to work quite well in cattle.
What about supportive care?
Essential. If there's severe hemorrhage, a blood transfusion might be needed. For perforating ulcers, broad-spectrum antibiotics are crucial to fight infection, usually given for at least 5 days, or until the cow's temperature has been normal for 48 hours. Fluid therapy is vital for bleeding ulcers to counteract dehydration and shock, and keeping cows with bleeding ulcers confined and quiet helps minimize stress. Sometimes surgery might be an option for perforated ulcers to try and repair the hole. Usually done via a laparotomy, and a right paramedian approach often gives the best access. But surgery generally isn't recommended just for bleeding ulcers unless they happen along with a displacement.
And what about those very sick calves with appomasitis?
Early intervention is everything, and critically, you must not feed them anything fermentable. No milk, no glucose-containing electrolyte solutions, as that can make the gas production worse. Instead, treatment involves things like subcutaneous penicillin, IV, or subcutaneous fluids, and an anti-inflammatory like Flunix in Meglamin. Sometimes, gently placing the calf on its back can help release trapped gas.
And the overall prognosis for ulcers?
It really varies depending on the type. Type 1, the superficial ones, are usually no big deal, often subclinical. Type 4, though, with that widespread diffuse peritonitis, the prognosis is very guarded, often fatal even with treatment. For type 3, with a localized peritonitis, the prognosis is generally good if they get antibiotics, although maybe less so in pregnant cows because the uterus can interfere. But the bottom line for all types is that early diagnosis and starting treatment quickly are absolutely essential for the best chance of a positive outcome.
Wow, we have certainly covered a lot today. This deep dive really drives home the surprising complexity and the significant impact these abomasal diseases have, from displacements that might seem subtle to acute emergencies like volvulus and these hidden internal battles with ulcers. It really shows the hidden vulnerabilities that can exist even in seemingly strong animals.
Indeed. It absolutely highlights how critical careful observation is, picking up on those subtle signs we talked about. And then prompt diagnosis and using comprehensive treatment strategies, it's all essential, not just for the well-being of that individual animal, but really for the economic health of the farm and the wider agricultural picture.
So what does all this mean for you listening in? Well, the sheer variety of these conditions, from a stomach's just slightly out of place to a life-threatening perforation needing immediate action, it really underscores how vital it is to look closely, to look beneath the surface. It's a reminder, isn't it, that often the biggest challenges are the ones we can't immediately see. They require careful detection and a deeper understanding. We hope this gives you a new lens to view things through. Keep exploring, keep observing, always look beyond the obvious. Thank you for joining us on this deep dive.